Hi there. My name is Julie Hirschberg. I am the owner of Re+active Physical Therapy, and we are a physical therapy and wellness program in the Los Angeles area where we really help people with neurologic disorders recover movement and strength and confidence through brain-changing therapy and exercise. And one way we do this is actually through helping to educate our own clients, participants in group exercise, and other physical therapists. And what we're learning and discovering all the time, we are the only place in the world at the moment that has a fellowship program for people, for physical therapists who want to dive in and understand movement disorders a little bit more. It's called the Schmidt Movement Disorders Fellowship. By the way, if this is something you're interested in, our application just opened up for next year for starting in 2020. And as part of this, we do regular modules diving a little bit deeper into topics in movement disorders. And we just did a module on freezing of gait. We had the very wonderful Erin Gallardo put together just a really awesome set of understanding both the pathology, the assessment, and the treatment for freezing of gait. And if you have Parkinson's or you've worked with people with Parkinson's, you know that this can be a huge problem. And actually, I just spoke with somebody yesterday who was really frustrated because he tended to take these very tiny shuffling steps when he went out to eat. And so what was happening is that he stopped going out to eat as much, and this was really impairing his quality of life. And those small tiny steps tend to happen due to freezing. So I'm not going to do our whole learning module over again, our mini course, but I wanted to just summarize some 3 great take-homes that we had from the course. This will be pretty brief today. We do have the whole mini course recorded from that evening. And so I'll put a link here. So if you want to dive deeper, that is still available. And the mini courses include a lot of great articles and resources for people, as well as the recording and the slides and handouts and all of that. So it's a great resource for people. So first take home, one of the biggest things that hit me, and again, such a big thank you to Erin Gallardo for this, was when we think about freezing, the literature is starting to show that there are potentially 3 different phenotypes or causes of the freezing, and one of those being a very strong motor asymmetry, meaning a marked asymmetry in symptoms from the Parkinson's. And one of the ways that they saw in the literature testing this out was through doing a series of turns, which is a really great screen to do for people to look for freezing. So that was one potential cause or phenotype of freezing. The second is anxiety, and I want to say this is one of the top ones that I personally see. And this is what you see, like the gentleman I talked to yesterday, in social situations, the increased anxiety leading to increased freezing of gait. And then the third phenotype was set shifting. So this difficulty switching between 2 things and dual tasking. This is something I also see a lot. So I think with these 3 types, what's nice in understanding this is how you assess and then treat it, right? So you can be really specific. And we talked in our mini course using something like the Freezing of Gait questionnaire, the Freezing of Gait assessments. This would be our initial step, but also doing things like screening cognitive impairment. So something like the trail making test, the MOCA, and screening for anxiety would also be very, very important to get at the underlying mechanism, so that so it's not like you're just putting a Band-Aid on it, but actually treating the real cause. So those were 2 of the first take home, that we have these 3 phenotypes, and then that leads us to how we would be assessing and really understanding the underlying mechanism for our patients. And then third the third take home, and it kind of ties into this understanding about underlying types, it only makes sense then that we would have different approaches to treatment. So adding in exercises and activities that directly get at some of the underlying executive function problems. And so this might be things like the go, no-go task, some punching inhibition, some life-size trail making, anything with the Stroop test. And the Stroop test is that tricky test where it says a color like black, but it's written in pink. And sometimes you have to say black, and sometimes you have to say the color that it's written in, which is in pink. So you have to inhibit some of your natural inclination. So using tasks like that within some of our movement and exercise can be really helpful. And Tara McIsaac, a great researcher from Arizona, you should definitely follow her and her work. She has presented this taxonomy of tasks to consider when addressing treatment. So basically considering how novel the task is and taking that from low to high, and then how complex the task is and progressing that from low to high, and considering each of the tasks that you may add in to an intervention and the environment for where the person might start and where you might want to take them to. So really helpful taxonomy to think about and plan treatments for people. So we had a really great discussion in the mini course about treatment ideas with a couple of different cases as well. And I think that's where a lot of my own learning comes from, is just hearing a lot of other ideas as well. There's a particular thing that I think is really useful. We didn't talk about this in the mini course because this was like a kind of a deep dive, but it's nice to give patients ways to get unstuck when they're frozen. And one of our wonderful friends and colleagues, Sarah King of Invigorate PT, she has this wonderful little video about the 5S method for stopping freezing. And I think a lot of people have heard of this. They use it. I share it with patients. It's a nice way to have a little rescue technique for when they get stuck, and I'll link it in the comments as well. But basically the 5 S's or S's: stopping, standing tall, shake it off, kind of decreasing tension in the body, shifting your weight with rocking, and then stepping, especially if you're frozen when you're walking, or shooting up, so like a large exaggerated movement. And I love her little video. I send it to people all the time. So I'll post that. I think it's a really great resource if you have Parkinson's and you're freezing. And then we also had one other thing I wanted to add to this. We had a great workshop sponsored by the Parkinson's Foundation last weekend. We had Dr. Giselle Petzinger and Mike Jakowick, who are an amazing dynamic duo of Parkinson's research. They came to the workshop and presented, and she showed some of her great research on skilled training, and the dual task training that we talk about for freezing would definitely be considered that skilled training. And by the way, her whole talk, I recorded it live on Facebook, so it's there if you want to take a look at it. But in our discussion after her presentation in the Q&A, we talked about the compounding effect of exercise and skilled training, and this idea that you might actually do some more intense aerobic exercise to prime the brain, allow some of these great neurotrophic factors to be released, and then add in this skilled training to decrease freezing. And I think clinically, this is definitely what I've seen is people start ramping up their overall exercise level, their capacity increases, and their freezing decreases. And I think it's because, from the neuroplasticity standpoint of the brain. So that was a great discussion to have. And I think, we can see and harness the power of that for people with Parkinson's as well. So there you have it, some 3 take-homes from our mini course from our Schmidt Fellowship. last week, and we're going to have our next mini course in July, all about posture and camptocormia in Parkinson's, which is another real hot topic. We'll be posting, that's not quite live yet online if you're interested in it, but I'll let you know. Certainly shoot me an email if you want to save a spot. Dr. Gallardo's module last week actually sold out, which was really fun. It was great to have people join us from all over the world for that mini course. So please shoot me an email. Also would love if you have any comments or questions to put them there, and we'll respond as well. I know I have a couple of links to put in the comments. Thanks so much for tuning in. We will see you next week for another live update.